complete physical exam on this rat named Karen. And as we discussed, everybody does it a little bit differently. The main thing is to have a systematic approach to evaluate the entire patient. So we'll start by checking her eyes. And basically we're making sure they're bright, they're clear, they're clean. She has normal blink reflexes and there's no discharge, no porphyrin discharge. And that her pupils are normal size and shape. Check that her nostrils are clear, that she's moving her whiskers, and that she seems to be breathing normally. Then we lift her lips to look at her gums, her gum color, her tongue color, and also check her front teeth. We'll move over to her ears and just check that her ear canals are clean and clear, there isn't any debris, any discharge, any evidence of any infection. This is a magnifier to look through the pupil in the back of the eye and also help magnify the front part of the eye to make sure it's normal and clear. Now I'm just going to start by palpating over her entire body, checking her front legs, making sure there are no masses or growths or bumps. And also a chance to palpate her abdomen to make sure her internal organs feel normal and that there's no growths or tumors. Check her anal area. And I'm going to turn her over so I can look at the bottoms of her feet. And also check her underside. I want to check all of the areas around her perineum, make sure everything looks normal. Make sure her knees feel fine and she's moving her back legs normally. And then feel her tail. Make sure everything feels normal. Then we'll listen to her heart and lungs. It's important not to confuse the breathing noises with the heartbeat. Good. Just making sure her heartbeat is regular rate, it's a normal rhythm. Making sure that her lungs are clear and her respiratory sounds are normal. And then we'll check her skin and her hair coat, checking for any parasites, any lice, making sure that her hair coat is normal and her skin looks healthy. And then we can weigh her, and one of two ways to do that is we can use a digital scale with the patient's own carrier, and we can set the scale to 0 and then put her in there to get her weight, or else we'll use a clear box and weigh her that way. But this way when she stands still we can get an accurate weight on her in grams, which is 572. And were we planning to do any procedures to her?